All right, let's talk about something that seriously trips people up in the OET, capitalization. It seems small, right? But getting it right or wrong can make a huge difference to your score. So today we're going to break down the rules, nice and simple, so you can walk into that writing subtest feeling a whole lot more confident.
So let me ask you this. Could one little capital letter, just one, actually drag down your OET score? It sounds kind of crazy, but the answer is, yep, it absolutely can. But don't worry, we're about to dig into exactly why that is, and I'll show you how to make sure that never, ever happens to you.
Okay, so why all the fuss about capital letters? Well, it's because it's a key part of the language criterion. See, the OET assessors aren't just checking your medical know-how. They're grading your professionalism and your command of English, and that's where capitalization comes in. It's a bigger deal than you might think.
Just think about it. In your actual job, you're writing referral letters, patient notes. These are serious documents where every single detail matters. If your capitalization is all over the place, it doesn't just look sloppy. It can genuinely affect how clear your message is. That kind of precision and professionalism, that's exactly what the OET is testing.
All right, let's dive into the universal rules. These are the non-negotiables, the absolute basics you've got to know for any kind of English writing, especially the OET.
Okay, let's run through these quickly. You always capitalize the first word of a sentence. The pronoun I, always a capital. Proper nouns, so think people's names, names of hospitals, specific places. Easy enough. Days, months, and holidays like Tuesday or March. In your letter, the abbreviation RE in the subject line. And, of course, the first word of your greeting and closing, like dear and yours. These should be automatic.
Okay, basics are down. Now let's get into the tricky stuff, the rules for medical contexts. This is where things get a little fuzzy, and honestly, it's where a lot of people get confused and lose easy points. So pay close attention to this next part.
First up, medications. This is a big one. The rule is actually super simple once you get it. You capitalize the brand name, like Panadol or Ventolin, because that's a specific trademark product. It's a proper noun. But the generic chemical name, like paracetamol or salbutamol, that stays lowercase. Think of it like this. Coca-Cola is capitalized, but cola isn't. Same idea. Brand name gets a capital, generic name doesn't.
And you know what? It's the exact same logic for diseases. Common conditions like skin cancer or heart disease, they're general, so they're lowercase. But if a disease is named after a person or a place, then you capitalize that name. We call these eponyms. So it's Parkinson's disease because it's named after Dr. Parkinson. It's Crohn's disease after Dr. Crohn. The key is to ask yourself, is it named after someone or somewhere? If yes, capitalize that name.
Job titles are another one that's all about context. Here's the deal. If the title is right next to a person's name, acting like part of their name, you capitalize it. So, Fiona Lee, lactation consultant. The title is part of her identifier there. But if you're just talking about the job in general, like the lactation consultant gave some advice, then it's lowercase. It's a difference between a specific person's title and the general profession.
So, just to hammer it home, here's a quick list of things you generally do not capitalize. Medical procedures like a biopsy or vaccination. Body parts, pelvis, adrenal gland, whatever. And common illnesses like malaria or jaundice. These are all just general nouns. But, and this is a big but, there's one thing you do capitalize. Acronyms. Things like ECG, CBC, CT scan. Those are always in all caps. Don't forget that one.
Whew, okay. That's a lot of rules, right? And trying to remember all that with the clock ticking in an exam, it's stressful. But what if I told you there's a secret weapon, a totally legit OET-approved tactic you can use if you're feeling unsure?
Yeah, you know that feeling, right? You're in the exam, your mind goes blank on a rule, or maybe you're just worried that your handwriting's a bit messy. Does that mean you're doomed to lose points? Not necessarily.
Well, check this out. This is directly from the OET's own guidance. It says it's perfectly acceptable to write in capital letters. That's right, you can write your entire answer in all caps. This isn't some trick, it's an official strategy. But there's a catch, a really, really important one. So you can use this all-caps strategy for parts of the reading and listening tests and for the entire writing subtest. That's huge. But here is the golden rule, the one you cannot break. You have to be consistent. If you decide to go all caps, every single word from start to finish must be in all caps. You can't mix and match. It is truly an all-or-nothing deal.
Okay, let's wrap this all up. We've covered the rules, we've covered the big all-caps strategy.
Now let's put it all into a super simple checklist for you to take away for exam day.
Here it is, your 4-step plan. 1. Nail the basics. Start of a sentence, the word I, proper nouns. Get those right every time. 2. Remember the medical pairs. Brand names, yes. Generic, no. Diseases named after people, yes. Common ones, no. 3. Know what stays small. Procedures and body parts are almost always lowercase. And 4. Have your backup plan. If you're in doubt, go all caps, but remember to be totally 100% consistent.
So, I'll leave you with this to think about. Now that you know all the rules and the little traps, which mistake are you going to be extra careful to avoid? Seriously, think about it. Pinpointing your own weak spot right now is the best way to make sure you don't make that mistake when it really matters.